Hi, Brittany.
Hi, how are you?
Excellent. I'm so glad to see you here. We got people coming in already.
I
You can
know.
you can do the whole like share screen, right?
I was just looking. Oh, here we go. Okay, let me see if this works. Let me know. Can you see that?
Yep, sure can.
Awesome. I'm gonna try and get it. There we go.
Yeah,
How's that
sweet.
look?
Perfect. It looks beautiful. Yeah, we should
Oh,
have got like about 5 minutes. So I'm gonna mute myself and try to stuff a whole bunch of food in my face real quick. And then I'll introduce you and we'll get started.
sounds good.
No problem. We're gonna start in just a couple minutes. Just a reminder to make sure if you're watching that you mute yourself unless you are the presenter. Hey, everybody. We're gonna go ahead and get started here. Let's see. Um, Welcome. This is our first little webinar that we're putting on behalf of Rocky Mountain Backcountry Horsemen. I organized some webinars to just get people introduced to different people around Colorado and hopefully around the country if we can get like real big. But the idea is to just present you with some basic information, show you what these people have to offer, and hopefully get you in touch with them if you want to do more. Because Brittany Steffensen here has a ton. Like she has a ton of information. I haven't been able to sign up for her class yet, but I want to sign up for her class, all of her classes, and then also be her. So I'll let you take it away. Tell us about yourself and then go ahead and get started. The meeting is yours. I will mute myself and be off screen.
Awesome. Thank you so much. Thank you everyone for joining today. Yes, I am Brittany Steffensen. I'm up near Boulder, Colorado, and I travel throughout Colorado just teaching equine first aid. And so we'll talk about what in the world equine first aid is. I'll give you information about when it started, some history on it, and then also just different types of wounds. And then I'll even do a little demonstration on Charlie horse leg here in regards to all of the different types of layers of bandaging that we teach in the hands-on portions of the clinics. So let's get started here. I have my PowerPoint here that doesn't want to move. Did it go ahead for anybody?
Not yet, but it might. I see
Ah,
your mouse moving.
yeah, okay, let's see, maybe down here.
It might just, yeah. Oh, no. Sometimes there's a delay on these kind of things. I just see a dark screen now.
Yeah, there's a little delay, no problem. Okay, so
Yeah,
I like
so build
to,
that in for sure. Go ahead.
yeah, okay. So I'm just trying to move this guy out of the way. So I like to start out with just some photos of what emergencies can look like, right? Obviously, this horse is not gushing blood or has any fractures, but can someone tell me what is going on here with this horse? All right. Well, this is colic, right? This is the quintessential stance of a horse that is colicking. No matter what type it is an emergency. And so this would be a call to your veterinarian, right? So this horse is uncomfortable. They're stretching out their stomach, right? They're trying to give themselves more room in there because something just isn't right. All right. Moving right along here. What about this? Would you call this an emergency? Feel free to unmute yourself and participate. That is definitely an emergency, right? So a lot of people like to keep their windows open, and we think it's cute when we can see the horses or the dogs or things like that with their heads out the window. Well, it's actually very dangerous. And just like any other small animal, if a horse can get its head through that hole, it will probably attempt to get its body through. So yes, this is a severe emergency. You can see there's a fireman on hand there. I usually ask people, at this point, what would you do? How would you get your horse out of this situation? There's a couple different things you could do. You could try to get them back through the window, but because the majority of a horse's weight is on the front of their body, you would have to put something tough enough, maybe some hay bales under its front feet, and then encourage it to back up through the window. Or you could call the firefighters, as we see in the photos here, and basically cut the wall of your trailer open or off. So the horse, again, we would balance it first and then cut off the wall to get them to safety. But again, keep your windows closed if you're traveling with your horses, right? This is a photo of a horse that has cast itself. I never knew what casting was, but it is a severe emergency. Casting is when a horse lays down and it is unable to get back up. As you can see here, this horse can't roll itself over, nor can it get its feet underneath it to right itself back up. And this is an emergency because a horse can only be down for a certain number of hours before its lungs start to fill with fluid. So this is an emergency that you would call your vet right away, or you would try to fix immediately, right that horse back up. This too is an emergency. Does anyone know what's going on with this horse here?
Laminitis.
Absolutely. This is an acute laminitic attack. The front hooves of this horse are so painful that he's trying to get as much weight off of them as possible. This horse is in the midst of an emergency, right? Laminitis, again, is inflammation of that internal lamina within the hoof. And what can happen is the P3, or that coffin bone within the front hooves, can loosen, right? That the tension of the lamina, which you can liken to Velcro, can get so inflamed that it can almost start to let go of itself. And what happens is that lamina is holding so much pressure and all those bones in place, along with the tendons and ligaments that come into the hoof, it can actually allow that bone to tilt or fall through, right, the sole of the horse's hoof. If a coffin bone falls through the sole of a horse's hoof, it cannot be put back in there. That is grounds for euthanization at that point. So a laminitic event, especially one that presents like this photo here, is a severe emergency. We need to cool those hooves off as quick as possible, right, and get our vet on hand. Good answer. Does anyone know what this is?
Choke.
That is choke. Thank you. Yep. So horses, okay, true or false, right? Horses can only breathe through their nose, not their mouth.
True.
True. Yes, horses can only breathe through their nose. And so when all of this debris, right, like this chewed up hay, for example, in this photo, is coming out of their nose, it's actually blocking their ability to breathe. And breathing is integral to living. So in this case, this horse has either not chewed up his food enough, maybe he doesn't have really great teeth, maybe he was chewing some grain and it expanded as it was going down his esophagus. Well, the only place for this chewed up food to come out is through the nose. This will present in a horse as a very low hanging head, obviously debris or foam, food coming from the nose, and then a very raspy breathing because they're having troubles getting oxygen into their system. So this is an emergency. We would call our vets right away. Our vet would come on hand and dislodge whatever might be stuck in our horse's throat. Sometimes it can move itself along, right? Move itself into the horse's digestive tract. We learn about different first aid protocols that we can take to help our horses if this does happen to them with us around. Right. Moving forward here. Okay, so like Hillary said, just a little introduction of myself. My name is Brittany. I live in Colorado. I have been a certified instructor with Equifirst Aid USA for over 3 years now. I have won the award of Instructor of the Year the last 2 years because I've been so busy. So thank you to all my students and all of you listening today. Without you, I wouldn't be in that position. My background actually, well, I guess my horse background, right? I've been on top of, around, underneath horses for over 30 years now. This is one of my grandfather's Percherons. He still raises them and breeds them today in Minnesota, where I'm originally from. And so I have a lot of horse experience. And then, you know, my background and things as far as college, I went to school for clinical psychology and also just a business degree in human resources. So I've been very human centric for many, many years. Well, until recently, I ignited my passion again for horses by volunteering at a local horse rescue up here. And I wanted to be more involved with the health portion, and there just wasn't a lot of movement or room to do that, specifically in a role there. And so I created my own role. I created my own business, which I call Open Air Equine, and got certified to teach equine first aid throughout the world through Equa First Aid USA. And so that's where I am today. Again, there is my website at the bottom. Again, Open Air Equine is my business that is underneath the umbrella of Equa First Aid USA. So I'm going to give you a little bit more information on Equa First Aid USA. And there's the website if you'd like to visit that and see, you know, when different courses are coming up, what are the courses we teach. But a little bit of the history of Equa First Aid USA is that it started, or it was established in 2007. So it started in Canada, and not until more recently did we start to get more instructors down in the US. So when I started over 3 years ago, I think we had maybe 15 people down here teaching. I'm just gonna get this sun out of my face there. And now we have well over 50, which is fantastic. But again, it initially started in Canada and has now trickled down and started their own chapter down here in the USA. We're all still using the same materials and that. But basically what happened was a group of veterinarians and horse professionals got together and decided, hey, horses are prone to injury for a lot of different reasons. We need to equip ourselves as horse people who love horses, people who volunteer with horses, people who own horses, people who are professionals as far as like training and farriers and things. We need to arm ourselves with the skills and knowledge to be able to respond in an equine emergency because they are prone to injury. And so that's when the veterinarians and all of the equine professionals like farriers, body workers, chiropractors, they got together and created the materials, right? Like this one here. This is our most popular clinic. This is our all-day basic equine health and emergency first aid. So that's all day, so it goes from 9 to 5. But they created these materials together. So everything that we teach is from veterinarians and horse professionals. And so the information is very thorough. And again, it just provides us with the option of being able to help our horses after they've been severely injured or even with minor injuries as well. So again, the courses are designed by veterinarians. We have a handful of courses, that range from a kid's course, right? So that's like 3 to 4 hours. And then we have the half day, which is a fundamental. So that's going to introduce people to bandaging as well as colic. So those are it's heavy on that. And again, that's only roughly 4 hours. And then our most popular is going to be the all-day basic equine health and emergency first aid, which is a prerequisite to our advanced courses. So we have the advanced backcountry, we have the advanced local trail ride, and indoor riding as well. And so those deal with the advanced courses deal with very serious injuries like flailing chest wound, or gosh, now I'm speaking weird, but like gaping chest wounds, punctured lungs, things like that. One thing that does set all of our clinics apart from any other one that you can take online is that we do require a hands-on portion for all of our clinics, which is really nice because not only do we have the classroom where we're discussing all of the different information and the theory, right? But we also get to then move to the horses and work with them hands-on. So for example, the all-day basic clinic, that's our most popular. In the morning, right, we talk about preventative action, which includes learning how to take our horses' vital signs, stretching our horses and identifying back pain, and then also taking their weight. And so after we discuss those, we actually go out and do that with the horses. And then we come back in, we have lunch, we do more discussion on specific equine first aid, like the reactive portion. So we come upon a horse who has an injury or is in a current emergency. And then we talk about different layers of bandaging and how you would think outside the barn as far as getting them on the road to recovery while waiting for our veterinarians. Again, everything that we teach in our courses never ever replaces what our veterinarians can do. Again, it gives us the skills and the knowledge, right, to respond in emergency, which gives us this sense of confidence too, right? You can pull out your manual that you get during the clinic and say, okay, I feel like my horse is going through this. I'm going to call my vet, and then I'm going to walk myself through the protocols per that injury that I'm observing in my horse. So again, you can find all the information either on my website at openairequine.com or equifirstaidusa.com for those different clinics and what each one teaches. And then just how to be a host, right? So I don't have my own barn. I do have my own horse, but I board him. And so as an instructor, I love it when people call me and say, I want to host, or I want to bring people to my ranch or my barn or stable to learn equine first aid. Sometimes they open it to the public. Sometimes they just keep it in-house where it's just everyone who either boards at their facility or takes lessons and so forth. So as a host, you provide horses that we can work hands-on with, and then a space for us to learn. And then I do everything else as far as marketing and registration and collecting payment and things like that. So nothing ever more gets put on your plate other than the day that we all come to your space and learn together. So again, what in the world is equine first aid? I always giggle when I'm on my way to a clinic and I'm at like Starbucks or something, and they ask, they're like, oh, what are you doing today? You know, and I'm like, oh, I'm gonna go teach, equine first aid clinic. And they're like, what in the world is that? Right. And I get that a lot, even with horse people. And it's like, well, actually, we can learn first aid, but apply it to horses. But, don't get me wrong, it's not just for horses. I use equine first aid on my husband when he crashes his bicycle, right? Am I right? Does anyone have any kids? I mean, this works for them too.
Stay calm no matter what.
Yes, stay calm no matter what. And that's, the first rule. So what is equine first aid, right? Equine first aid is going to be that first available intervention that we can provide our horses upon an emergency, right? So while we're waiting for our vet to arrive, while we're waiting for a first responder. So that's why it is of utmost importance for all of us to have this under our belt. So not only is it important for us to be able to recognize, right? A lot of you knew what those photos were, whether it was a cast horse, a horse, showing laminitic pain in their front feet, choke, right? A lot of people don't have the knowledge or the exposure to some of those very serious emergencies that horses can get themselves in every day. And so not only do we want to be able to recognize these issues, we also want to be able to respond. And that's where equine first aid comes in. So whether it's a simple or complex emergency, you must know how to recognize and respond appropriately, because the eventual outcome for your horse, right, depends on that. It depends on how you respond, what action you take, right? We don't want to make anything worse. When you contact your veterinarian, and then the accuracy of information you provide them. So when we talk about accuracy, we usually say, make sure to provide them good, right? Air quotes, information. It's like, well, what's good? How do you define that? It's so vague, right? And so when we talk about accurate or good information, we're really talking about being able to provide them not only, hopefully, your horse's vital signs, but also what exactly is going on? What are you observing, right? So hopefully you are able to give your vet basically a front seat to what's going on. Okay, so observation is key. We don't want to discuss how our horse is feeling sad, or he just looks off. What does off look like? Right? What does the injury look like? How is the horse holding their body or their head or their limbs, right? So keep that in mind. Okay. So prompt emergency treatment can, right? We're going to preserve our horse's life, alleviate any sort of suffering that they're going through. We're going to aid the veterinarian's efforts, and then start to promote our horse's recovery as soon as possible. Okay. So I just want to jump back one. When I say aid in our veterinarian's efforts, that means we're providing, right, that accurate or that good information, right, vital signs, for example, and also, you know, what we're observing as far as the emergency to our veterinarian before they get on site, right? It's very important that our vets are prepared, right, when they get there, because they might have to park at the barn, come down to where your horse is because you're unable to move him, for example, go back to, right, observe what they see, go back to their truck, get what they need for this emergency, and come back. We want to provide them with enough information so they can park, grab what they need, and meet us where we're at because we're dealing with an emergency. Does that make sense? All right. So again, equine first aid is about being prepared, right? So again, that upper left hand photo, that's a horse that's been cast, right? We talk about in our clinics, right, the all-day basic, when a horse gets cast and how to get them out of that situation, right? There's only a certain number of hours they can be down before a severe emergency occurs, right? That lower left picture, that's a pretty deep laceration. I would say that is definitely going to be a vet call, right? But we need to be able to support our horse, give them some sort of alleviation while we're waiting for our vet. We all know that the number of vets in the country, right, is lowering each year for many, many reasons. And so we need to be able to be prepared to not only help our horse, but also wait for our veterinarian. We might call our vet with an emergency, but guess what? They could be on another emergency already. And so it could be up to 3 hours before they get to you. So again, having those skills under our belt, knowing how to respond is of utmost importance. Again, that middle photo, a very deep, deep laceration. I'm going to say there's probably some tendons involved there, so that's an emergency. Upper right hand is going to be that horse, that quintessential stance of that horse trying to stretch out their belly when they're dealing with some sort of stomach pain or colic. And then the lower right, what in the heck? That would be my first response if that was my horse. Can anyone share how they might get their horse's foot out of a cinder block? Yes, I would be in shock as well. Okay. But this horse specifically ended up being fine, right? They were able to get the cinder block off. I don't know if they had to sedate the horse or not, but they did take a hammer to it, right? And they had to break it off around the leg, being careful not to cause a secondary injury from the cement that was breaking. So, yay, horses. All right, so I kind of alluded to this already, but what would you guys say is the first rule of equine first aid?
Guys, don't pick B.
It's not B, but who went there? Who went there in your head? Who did that?
Right.
I have done that.
Yeah. And like there's an option E, don't get your phone out and start filming.
Yeah. Not B, not E, right? Okay, so it's going to be D, of course, right? We need to remain calm. Remain calm, guys. Our horses are creative. They like to increase our heart rate, okay? So the first rule of equine first aid is going to be remain calm, right? Your calmness is of great importance in reassuring your horse and minimizing any further injury or complication. For example, let's say our horse has a bleed. If we come up to our horse panicked, oh my gosh, there's so much blood. What do I do? What do I do? Our horses can sense our heartbeat from 4 feet away. What do you think our raised heartbeat is going to do to their heartbeat? Right? It's going to increase their heart rate. And what is an increased heart rate going to do to a bleed? It's going to make it bleed more, right? Again, remain calm, right? And that's what these clinics are so good for, is they give us that confidence, right? Well, I have my first aid manual. I've learned how to do this. I need to remain calm. I need to be there for my horse. So if anything, have the mantra of Remain calm, remain calm, remain calm. Okay, true or false? Horses are prey animals, which makes them prone to injury. Anybody? True, right? Horses are in fact prey animals, and so they are going to respond in two different ways, fight or flight. Okay, there is a freeze, but horses don't really fall into that category. So horses are going to fight or flight. And majority of the time, horses are going to flight, okay? They are fast land animals. They are going to run away from anything, whether it's an actual mountain lion or it's a plastic bag blowing through the pasture that looks like a mountain lion, okay? So upon their flight, right, this is when injuries can happen. This is what makes them more prone to injuries. So whether it's a torn tendon, when they step in a hole, they could get a fracture, they could get caught up in barbed wire fence. It happens, right? And so that's why we need to prepare ourselves for injuries that are horses. What's that? Okay. So horses are flight animals, right? They're prey animals. One saying that I've learned to describe flight animals is eyes on the side, I must hide. Eyes in front, I'm on the hunt. Right? So predators' eyes, like our eyes, are in the front. Right? Horses' eyes are going to be on the side because even when they go down to drink water or eat grass, they are looking out for anything that is trying, a predator that is trying to eat them. Okay, here's some injuries. So the horse on the left, I don't know if you guys have ever seen a unicorn in real life. Well, this horse wanted to be a unicorn this day, and so this is a stick that went inside this horse's sinus cavity. I always thought to myself, how is that horse still alive? Well, the sinus cavity is in fact behind that stick. And although we're only seeing about 2 to 3 inches of that stick, it was closer to 6 or 7 inches long. Yes. We do not pull that out. We're going to call our veterinarian right away, right? And we're going to stay calm and we're going to keep our horse calm, right? The upper right-hand photo, that's going to be your puncture wound, right? Nothing stuck in there that we can see, but something has went in the deep tissue and come out, right? Leaving a nice, beautiful hole. And then if you can compare that front foot in the bottom right-hand photo to the back foot, you can see right there, that's what's called a dropped fetlock. That's from either a torn or stretched ligament, right? This is going to be an injury that a horse may or may not come back from, but it's definitely going to take a long, long time for it to heal if that is the prognosis that our veterinarian gives us. Anyone ever dealt with any of these before?
I did,
Yeah.
I did want to ask, like, I was wondering that the tendon one,
Yeah.
is that related or not to a bowed tendon in some way?
No, so a bowed
Whole
tendon is going to
different,
be up higher,
okay,
right? So it's going to be up on here. Let me
different
Charlie
location.
horse. Ugh. This is my horse leg. So this is going to be the dropped fetlock, right? So all the tendons in here have stretched or torn and dropped that fetlock. This is where you're going to see a bowed tendon,
Okay, very
right?
cool.
This tendon here. Yeah.
I never really thought about it. Thank you.
Yeah, good question. All right. So there are going to be a handful of reasons why, hands down, we call our veterinarian no matter what, right? And I'm just going to go through them here. So wounds, but specifically, right, we're going to call our vet when we have a wound that is less than 6 hours old and is gaping in nature. So when we say gaping, right, we mean you can put a finger in it, right? You can lift the skin up. Basically, it's a wound that requires sutures. Okay. It's not something that is going to heal back onto itself, right? It's not like superficial scrape or something. For example, my horse impaled himself on a T-post that the cap had come off. And so he fell onto it and went in his chest, almost up to his jugular. And because he was stuck on it, he jumped over the fence, right? In so doing, teared open his chest, and it was basically flapping in the wind like a flag. And so at that point, that would be a gaping wound. I could fit my fist in it. So we're going to call our veterinarian for that. A wound that is near a joint, right, is very serious. We're going to call our veterinarian for that. In addition, if there is a wound at the rear of the leg, what you were just talking about, Hillary, if we have a wound, this is also known as like a tendon sheath. So it's a very thin part of skin, and right below it is going to be tendon. So if we have an injury on a tendon sheath, we're going to call our veterinarian ASAP. This can lead to lameness in our horse forever. Basically, it can cripple our horse. In addition to that, if we have an injury that's near or on a joint and there's any sort of clear liquid or fluid coming from that area, that's what's known as synovial fluid or joint fluid. That is a very serious emergency. Again, joint fluid is meant to stay inside the body between joints, right? Just like when you put oil in your car and it lets everything move very happily together. If it starts to leak out, what happens is it's bone on bone, right? Very painful, not a good situation. Again, it can cripple your horse. So keep an eye out for synovial fluid around any joint injuries. All right, wounds specifically that are excessive, that have excessive bleeding that cannot be stopped with any sort of compression or bandaging. Again, we'll talk about bleeds in a little bit, the difference between the two. Any puncture wound, no matter how small this puncture wound is, if it causes lameness in your horse, that is an emergency, okay? And then that's it, right? So we have the gaping wound, the joint or tendon sheath wound, a puncture wound, and an excessive bleeding wound. Call your veterinarian, okay? Next is colic. Again, colic can range, right? There's definitely different types of colic. And so we have the umbrella of colic, but then we have all these different types. And no matter what type it is, whether it's sand colic or something more serious, right, where their intestines flip over, like a torsion colic, we're going to call our veterinarians. Colic can go from mild colic to severe colic in a matter of minutes. Okay, so we never, ever, ever want to leave our horses when we think they might be having colic, no matter how minimal it might look. We're also going to call our vet if there is severe lameness in our horse. And what I mean by that is, let's say our horse is three-legged lame, right? They're not going to put weight on one of their limbs. That's an emergency. Something is going on. It could be a laminitic attack, right? Or it could be something is stuck in a hoof, right? It could be even as severe as a fracture. So again, three-legged lameness is always a call to your veterinarian, right? Any sort of eye injury, right? Whether they have something stuck in it, whether it's, got excessive oozing or dripping, if the eye is closed, right? Because it's painful, leave it to the professionals. Eye injuries are for veterinarians or ophthalmologists only, okay? Choke, like we saw earlier. If there is food or debris or anything coming from our horse's nose, right, they are probably choking. Something is stuck in their esophagus. This is an emergency. Again, our horses can only breathe through their noses, and so we are going to want to get our vet on hand right away to unblock that piece of food or whatever it may be that's stuck in there, causing our horses to struggle to breathe. And then, of course, if you are expecting a baby horse, right, we're always going to call our veterinarian upon them starting to foal. Hopefully, we're working with our veterinarian hand in hand along the way, just making sure that everything is going well and mama is doing well too. Okay. Would you call your vet in this situation?
Absolutely.
Yes, thank you, Kelly. Absolutely. Can you fit a finger in there? Yes. This is a photo from one of my students she sent me after, and she said, all I kept telling myself was remain calm, because of course this is after it's been shaved and the blood has been washed away. But when she showed up to this young guy, it was a very, very bloody massacre mess, and she wanted to panic, but knew she had to be there for her horse. So yes, indeed, this horse needed sutures. It was not an arterial bleed, thank goodness, but it was deep enough where they needed to take extra measures to get it closed, not just a Band-Aid. All right, so different types of wounds, right? So we've seen a couple in photos previously already, but the first type of wound, or the types of wounds that we talk about in our clinics, are going to be the straight cut, the tear, a puncture, and then a foreign body, right? So a straight cut is exactly what it sounds like. Okay, a horse comes around a corner, there's a nail sticking out, they slice open, their side, right? Again, it might be deep enough where it needs sutures, but again, because it's straight, they're just going to suture it right back together again. Very easy straight cut, okay? Versus a tear, right? I always like to do the example of tearing a Kleenex, okay? This is a tear, right? It's messy. It doesn't have clean lines. There's a lot of skin and things that might not easily be sutured, but again, it's a uncontrolled tear or straight cut, basically. So that is going to be a call for a veterinarian for sure, right? Then we have our puncture wound. So we saw a photo of that earlier. The puncture wound is a type of wound made when something sharp like a stick or a nail, I guess anything that our horse decides to lean on, right, goes through the skin and into the tissue underneath, right? But it comes back out. Puncture wounds are usually pretty difficult to find, right? Unless they are bleeding pretty good. But because that object goes in and comes right back out and the fur usually lays right back over it, again, not always found right away. It can cause infection. And then we have fourth is that foreign body. So again, that unicorn horse, right? It's foreign to our horse's body because it's not supposed to be there, right? They were not born with it, okay? So again, a puncture wound where the object that punctured them is still in place. Okay, hopefully. All right. So what is the most dangerous type of wound out of those four, and then why? It's going to be your puncture wound, right? So again, a puncture wound, often difficult or just not obvious to find if it's like hidden, especially lower under the body and the fur has covered over it once it's gone in and out. So again, if we don't find it right away, it can leave debris behind. So let's say it was a stick or a piece of wood off the fence, right? It can leave pieces of wood stuck in the wound, causing infection. Infection can cause temperature, a high temperature, okay? So that's why a puncture wound is going to be the most dangerous out of the four different ones that we just talked about. All right. I'm going to need some participation. What kind of wound is this?
Puncture.
Yes, it's a puncture wound, right? Nice deep hole, but nothing is left other than maybe some hiding pieces of whatever punctured that horse.
Go ahead
What
and
is,
unmute yourselves if you want for a few minutes, guys.
yeah, what is this wound that we just talked about? Was the horse born with it?
It's a foreign
Yes,
foreign
foreign
body.
body. This one's a little harder to see, but what would you consider this one?
A tear?
Straight cut. Yeah,
A
yep.
straight-
So yeah, so this one's a straight cut because it's very easily put back together and good. What's this?
Tear.
That's the tear, right? So it's torn skin in an uncontrolled manner, right? So when you're trying to suture that back up, it's not going to be quite as straightforward as a straight cut is, right? And this one,
Is that another puncture?
On body, there's a screw in his foot.
yes, that's a foreign body. It was not born with the screw in its foot, right? Good. Yes. Awesome. I hope no one ate too early. Okay, so when we talk about bleeds, when we talk about wounds, we always bring up the different types of bleeds, right? There's two different types of bleeds, and I want everyone to make sure that you know what they look like. So we have bleeds from veins and we have bleeds from arteries, okay? So a venous bleed is probably a bleed that you've seen on your horse maybe every day, literally. So it's going to be a darker red. It's going to be more oozing in nature. Okay, so it's not something that, I mean, it still can be very scary, but it's not necessarily an emergency, right? Like the arterial bleed. This photo is an arterial bleed. Okay, so an arterial bleed is different in that the blood is going to be more of a bright red. And also because arteries are under so much pressure, the artery bleed is going to basically pulse, right? Or spurt, for lack of a better word, with the heartbeat of the horse, right? These bleeds can go far. And again, they are not going to stop on their own. We are unable to stop them just with compression and bandaging ourselves. So this is an emergency. A horse can bleed to death as a result of an arterial bleed. So again, we never want to make a situation worse. I had a gal at one of my presentations at the expo recently who said, my horse had this exact injury and I took a hose to it, right? She wanted to clean it off. And what happened? It made it worse, right? This is one wound that is the only exception to when we do not clean it, right? It is cleaning itself. Okay, the blood is coming out so fast and so fierce, right, that it's flushing anything out that may have been in there. So keep that in mind. How much blood can roughly a 1,200-pound horse lose before going into shock? 2 cups, 2 pints, 2 gallons, 2 tablespoons. What's your guess?
Two gallons.
Horses are big.
Yes, it is
I got
2
this
gallons.
one wrong last time, I had to guess.
Yes, yeah, it's 2 gallons. Absolutely. So again, that's a 1,200-pound horse. Does anyone have a 1,200-pound horse? Because my horse is not 1,200 pounds. But something to help you keep this in mind, there's a little experiment that I want someone to do this and send me photos of. You can take like a gallon jug, okay? Any type of gallon jug, milk jug, let's say, and mix up fake blood. So it's usually water, cornstarch, food coloring, okay? And once you have your gallon of blood or your 2 gallons of blood, I want you to go around your property or wherever you keep your horse and dump parts of this blood on different ground types, right? So if you were to pour a gallon of blood in an arena, right? Arenas are usually kind of soft, sandy, deep, right? It might look like a spot of blood, but as you push the sand away, you're going to see just all of the blood hiding underneath. Versus if you were to dump your fake blood on cement, right? Let's say you have cement in your barn and a horse was standing there, it's going to look like a massacre, right? So this just gives us a good idea of what a bleed will look like, okay? So that previous photo where my student had sent me that picture of her horse who had that big cut on his neck there, she said there was so much blood that she just kept repeating to herself, remain calm, 2 gallons, remain calm, 2 gallons. It wasn't close to 2 gallons, but it definitely looked like it, especially, when she was in the midst of it. So again, 2 gallons before a horse goes into shock. Okay, we don't want them to get close to that, right? Our first aid protocols for an arterial bleed is to stop it immediately. Again. Okay. Any questions so far? Any comments? Usually there's like dialogue and things, and I'm not just like blah blah at people. So feel free.
Yeah,
Okay.
now's a good time if anybody has questions. I've gotten to see this presentation already, so I don't have questions, but I'm learning something new this time that I didn't catch the last time because I was talking with my friend for part of it, but you know,
What did you learn?
ADHD. Gosh, like the thing, well, for sure the tendon thing, like
Yeah.
the broken
Yeah,
tendon
yeah.
versus the drop tendon. And then like seeing it again, all of the tears and punctures and things like that, learning that a little bit better, seeing it
Yeah.
again.
Yes. Good, good.
Yeah.
Like I said in the clinics, right? And again, the most, popular clinic is that all day equine health and emergency first aid. We go over so much. I mean, it's an 8-hour day, right? And so this is just scratching the surface, but that's how, why everything is so important. And so again, what sets us apart from any other learnings that are out there as far as equine first aid is that we do the hands-on bandaging, right? Well, we do the hands-on vitals and stretching and identifying back pain and taking their weight, but we also do bandaging based on real life injury scenarios where I say, okay, the horses that we have today, they have an injury here. Based on what we've learned through all of our discussion, how are you going to handle it? Right. And so we talk about the different layers of bandaging. So who has an equine first aid kit?
Oh, we definitely have. I know we have at least 1 or 2 people in this chat that probably have a first aid kit. And
Good.
if you guys want to unmute yourselves, I will just mute you if there's any kind of feedback going on. So if you want to unmute yourself or show your face, please do for this last half of the presentation.
Yeah, I have a first aid kit in my bag.
Great. Do you have a first aid kit in your trailer, in your barn, on your saddlebag?
In my I have one that I take in the saddlebag with me, and then I have another one for if we ever are at camp to do that at camp.
Awesome. I'm so glad to hear that. I'm hoping that, right, and I'll have a list of other items that you can take a picture too that you should have in like your big equine first aid kit, whether it's in your trailer or at your barn. I know some barns have their own, but it's always good to have yours, especially if your horse is removed from the main area. But hopefully, I think was that Kelly talking?
No, it's Michelle.
Oh, Michelle, yeah. Hopefully, Michelle, that you have all of these different layers that we're going to talk about, and I'm going to demonstrate on Charlie horse leg here. Hopefully, you have all these in your kit that you carry with you, right? Because not only is it good for your horse, but let's say your horse dumps you, right? And you're kind of banged up, like you can always bandage yourself up too. Get you back to the trailer because your horse is going to be there. Okay, so the different layers of bandaging, we have 4 layers and the 5th one is optional. So your first layer of bandaging is going to be a non-sticky or non-adherent sterile 4x4 pad. I have all of my goodies right here. So this is going to be your sterile 4x4 pad. Notice that it's in its own package, right? That makes it sterile. It even has an expiration date on the back of it that tells you when to get rid of it because it becomes unsterile. So again, it's not sticky. It doesn't stick to wounds, but this is going to be your first layer, that sterile 4x4 pad. This is the only thing that we want touching an open wound because it is sterile, okay? Next layer is going to be our thick layer of cotton padding to protect, absorb, and minimize the risk of any pressure sores. Okay, so this can range, right? It just needs to be thick enough cotton where if we have an injury down here right? That it can go all the way around the leg once or twice to provide enough padding on both sides, right? We never just want to focus on one side of the injury and leave the other side open, because we could cause a secondary injury. Let's say if the injury was on the front and we don't cover the back, we could cause an injury back here just simply from the rubbing of the different layers of bandaging that we use. So again, I use cotton tea towels, right? Nice and long, go around the leg from Walmart, for example. Diapers. I could go on and on. I could do an 8-hour presentation on what the use of diapers are or can be in the equine field. Diapers are great, super absorbent, flexible, and you can also just use the tabs that are provided for you, okay, to keep it in place. In addition to that, you can use other towels, and then, you know, at your basic Jack's or Murdoch's or wherever you shop online, they have rolls of cotton too that are super thick and really fluffy and puffy. Those are fantastic as well. They are a little bit more expensive, so keep that in mind. But again, making sure that you have that second layer of thick cotton padding for the absorption and your first layer of compression, okay? Next layer, your third layer, is going to be your cotton gauze roll. Again, this is in its own package. It doesn't have to be sterile. Again, the only thing that is touching our horse's wound is going to be our sterile 4x4 pad. So don't worry about this, okay? So sterile 4x4 pad, thick cotton, and then we have our cotton gauze roll. The gauze roll is going to mainly just hold everything in place, right? Especially if you're working by yourself. It's really difficult if your horse is dancing around, because not all of them like to just be bandaged, you know, especially when they're hurting. So you can see here that our cotton gauze roll is very thin, it's very flexible. It can't get too tight around your horse's leg. It's going to hold everything in place. And again, it's going to provide absorption as well as a little bit of compression, just based on its nature, okay? So that's going to be your third layer. Last but not least, of course, is going to be your vet wrap or Coban or whatever you want to call it. It is self-adhering, right? So the one thing we have to know about vet wrap is that it can get too tight on your horse's leg. So as we are bandaging our horse and we come to this final layer, okay, as we're wrapping it around the horse, which I'll demonstrate in just a second here, as we're wrapping it around the horse's leg, we take out a big piece of it. You want to pull 100%. See how I take out all the stretch? Come back 50% and then wrap it around the horse's leg. Okay, that's going to keep vet wrap from becoming a tourniquet. Tourniquets are not okay in the horse world. We do not want tourniquets, not even for an arterial bleed, okay? So keep that in mind. All right. And then last but not least, again, this is optional. It's called an expansion joint. I will demonstrate this on Charlie horse leg behind me there. An expansion joint is an absolutely fantastic data point for us. So our horse gets injured on their leg. We notice our first step is always going to be to clean it, right? So,
Hey, Brittany,
yeah.
I just interrupt to have you stop sharing your screen so we can see you bigger.
Oh, yeah. Okay, take a picture of these.
Thank you.
Let me stop sharing here.
And we can go right back. We can go back to sharing if you have more in the presentation, but then we can see.
Yeah.
All right.
Is that better?
Definitely. Go for it.
Okay. Okay, so this is Charlie horse leg. So our last optional layer is going to be what's known as an expansion joint, and it's with duct tape. This is just yellow duct tape, because I like the colored stuff. It's more fun. So basically what an expansion joint is going to allow us to see is whether or not there is swelling going on in wherever we have bandaged the limb, okay? And I'll show you that in just a second here. All right. So here we go. Let me get my chair out of the way. Okay. Can everyone see this okay? All right, so this is Charlie horse leg. And as you can tell, he's got an injury there to his front leg. It's nice, bright pink. It's not an arterial bleed, so don't panic. Well, we're not panicking anyways, because, you know, we know what we're doing and we know the rules of equine first aid. So, first and foremost, right, let's set up our workstation, right? So, again, if we're alone especially, let's get everything set up just so we're ready to use it, right? So we're going to open our sterile pack, right, and make sure it doesn't get on the ground. We're going to have our cotton nearby, right? We're just going to put everything in a row, and then we're going to have our gauze roll out of the package and ready to wrap, as well as our vet wrap, okay? So prepare the scene before we start going. One other helpful tidbit too is that you can put little pieces of duct tape either on your leg. Sometimes, you know, if your horse is wearing a blanket, you can stick little pieces of duct tape on there too. So if they do start to dance around, you can just take that duct tape and slap it on wherever you have left. Let's say you have your cotton roll around the leg, right? You can just put it on there. Hold everything in place, let your horse do what they have to do, and then get back to the layer and the bandaging. So here we go. All right, so Charlie horse has an injury on his front leg. I have cleaned the wounds, right? Because it's not an arterial bleed. I just want to get a better look of what I'm working with. A look at what I'm working with. So I'm going to start with my sterile 4x4 non-adherent pad. And then I'm going to follow up with my cotton. I'll just use a diaper. So here we go. First layer is going to be sterile. Second layer is that thick cotton padding that goes all the way around the leg because we don't want to cause any secondary injuries on the other portion of the limb or wherever we're wrapping, okay? So there we go. We have the first layer of absorbency and compression with our thick cotton layer, which is my diaper, okay? Then we're gonna move on to our cotton roll, okay? So if you didn't use a diaper, obviously it holds itself in place. Your cotton roll is going to hold everything in place, provide some compression and additional absorption, okay? So this is going to be our back left leg. Notice how, like, this would be the other leg over here. Notice how I'm bandaging to the inside of the horse, right? Another descriptor is pulling the tendons towards the inside of the body where it's safer. Right? And again, there might be wrinkles, there might be things going on. In an emergency, it does not matter what your bandage looks like. The functionality of the bandage matters, okay? All right, so again, this one is non-self-adhering. So I'm just gonna give her a little tuck in here to keep it in place. Or if my horse started dancing, take that duct tape off my leg and slap it on there, okay? Next is going to be our vet wrap, right? And again, vet wrap can get too tight. We do not want it to be too tight on our horse, okay? So what I'm going to do is I'm going to pull out some of the vet wrap. I'm going to yank 100%, come back 50, wrap around the leg, okay? 150, wrapping. 150, wrapping. 150. Okay, we'll stop there. Usually I just use the whole thing, but all right. Okay, notice on this wrap, I'll bring you a little closer. Notice on this wrap that, oh, there's a little showing back here. I have the gauze roll or the cotton, right, layer showing at the top, and I've covered it at the bottom here, right? This is another data point for us. If our horse's injury is worse than we realize, right, and it continues to bleed and soak up everything underneath here, all of our layers, it's going to show us at the top here, right? We're going to be able to see, oh goodness, that injury is worse than I thought because now it's bleeding through and it's come up to the top, right? It's wicked all the way up to the top. I cover the bottom portion, right? Especially because this injury is lower. I cover the bottom portion of the bandage to keep the bandage from wicking up any sort of dirty water. It could wick up urine, right? We just want to keep as much ick out of there from wicking up to the injury itself. All right. So we have all of our layers here, 4x4 sterile pad, followed by thick cotton, right? Use as much as you'd like. And then we have our gauze roll to hold everything in place, also absorption and compression. And then our vet wrap that's not too tight. How do we know it's not too tight? We want to be able to fit some fingers in there. 2 fingers, okay? That's going to be our measure of whether or not it's too tight. Okay, and then optional is going to be that expansion joint with your duct tape. If you don't have duct tape in your barn or near your horse or in your first aid kit, I'm judging you right now. See those judging eyes? Duct tape is your friend, okay? You
Those
can
are
put this-
intense, you guys.
Huh?
I feel judged.
You can put duct tape directly on your horse. I just want everyone to know that. Okay, so this is our expansion joint. It's a long piece of duct tape. I'm not going to go directly over the injury itself, but I'm going to go a little bit higher. I'm going to bring it all the way around the horse's leg, and I'm going to meet the tails together in the back, okay? See how we have this flag now? Right? This is another data point for us. See if I have my permanent marker in here. New. Okay, hang on one second. Okay. So you will have a permanent marker as well. And what you're going to do is where the tails meet in the back on this crease, you're going to mark that with your permanent marker on both sides. Okay. So now we have both lines meeting each other. If you are to come back out and those lines are no longer touching each other, right? The tape has expanded. We are dealing with a lot worse swelling than we realize, right? So that's what the purpose of an expansion joint is. And again, it's made with duct tape. Duct tape is no match for swelling in a horse. So if you do have concerns about whether or not it splits, I have personal experience with it working, as well as others that I know who have used this for a visual data point. So we have the expansion joint as a swelling visual data point, and then we have our gauze roll or cotton layer as a bleeding visual data point. Good? Any questions? All right. So one helpful thing as far as directionality when you're bandaging, if you're a visual person, stand behind your horse, right, and swim, right? So depending upon what side of the horse you're bandaging on, you're gonna swim from the back, okay? If you're standing behind your horse and you have an injury on the right side, you're going to want to bandage clockwise, okay? If you have an injury on the left side, you're going to want to bandage counterclockwise. All right.
I want to see everyone doing the swimming motions on their cameras right now, because that's what I was just doing. Like if I'm standing behind my horse, my right hand swims clockwise and my left hand swims counterclockwise. So
yeah,
I learned another new thing.
Yeah, so a lot of people are visual in that way. Some people describe it as pulling the bandage back, right? Or pulling the tendons inside. You're not actually pulling the tendons or moving the tendons, but you are, bringing the tendons within inside the body where it's safer versus pulling the tendons out the body, right? You're going to get injury to the tendon. It's easier to get kicked and things like that. So let me share my screen here. All right. So moving right along here. Cool. There we are. And so here, I don't know why these don't show up, but here is that list, right, of first aid kit essentials. So again, we're not always going to be able to fit every single thing in our trail kit, for example. But this is what you want, all of this and more, right, in your barn first aid kit or in your trailer first aid kit. And then you can pare it down like Michelle was talking about as far as what she brings with her on the trail in her saddlebag. So clean towels, bandages, gauze wrap. Of course, you want your sterile 4x4 pads. One thing that I forgot to cover was, do we or should we put any sort of salve or neosporin inside the wound? No. If we're going to call our veterinarian and we want our vet to see this injury because we're uncertain if it needs stitches or not, or we're just not comfortable covering it up for the night, let's say, we're going to call our vet and they're going to come and they want to see it for what it is. They don't want to have to scrub out any sort of ointment that we've put in there. So same with colic, right? Do not administer Banamine or the like without asking your veterinarian first. If they're on their way, they don't want to get there and have your horse seem calm or, their vital signs be impacted by a drug that was administered before their arrival. Keep that in mind. Wire cutters are great to have in your first aid kit, scissors, flashlight, wound gel. Also for like larger injuries, is going to be like a blood clot or a blood stop, Celox, for example. All right. One last hurrah before I'm done here is the quote by our founder, one of our founders: the worst time to train your horse to accept treatment is when they need it. Okay, so let's all be very conscientious of what holes or areas of opportunity our horses have when it comes to bandaging them, right? Do they allow you to touch their ears? Injuries happen up there on their face, on their ears, on their mouth, right? We need to get into their mouth when we're taking vital signs, for example, like hydration. Do they allow you to touch their belly or their private areas, their sheath, for example? Do they allow you to touch their legs and lift up their feet? What are our veterinarians going to use when they come to our horse if it's an emergency? That's what our horses need to be used to. I learned this the hard way. Even taking this class, I thought my horse was a rock star when it came to everything. In fact, he wasn't. He was afraid of the clippers, right? The buzzing and the vibration of the clippers. So please see if your horse accepts that, because when they have a large wound, your veterinarian is going to remove their fur to be able to not only get a better look at the wound, but also be able to suture it. Soaking their feet, right? Spraying them with a hose or soaking their legs with a hose. Not only is the water an issue sometimes, it's the hose itself. Looks like a big snake. So keep these in mind. All right. That's it for me. I just want to say a big thank you again for having me. And I appreciate everyone attending, and hopefully you can make it to one of my clinics, whether it's the half day, hopefully the full day, so then you can come to the advanced. I have them all on my Facebook. Anytime I have a clinic, I have them, at Open Air Equine on Facebook. And my most recent one that is coming up is going to be June 2nd in Elizabeth, Colorado. So if that's something you want to come to, let me know.
Can you,
Thank-
excuse me,
Yeah.
remind people that maybe came in later, like other ways that they can maybe participate in your clinics? Because I know that you, like, people can host as well. And then Jill, we'll take your question in a second.
Cool. Yeah. So you can just reach out to me by my email, openairequine@gmail.com. Find me on Facebook at Open Air Equine, and also openairequine.com, right? That's where you can get all of your questions answered as far as how to host, what it looks like to be a host, in addition to all the descriptions of the different clinics that I provide, as well as if you want to go to the headquarters page, you can go to equa-firstaidusa.com. I'm wondering if I have it on. No.
Jill asked the question, what is the sugar for?
The sugar, yes. So for many, many, many years back in the war times, right? A concoction, which you get in our all-day equine clinic, you have a concoction of sugar and betadine mixed together, which is actually a poultice.
Very cool. I don't see any other questions in the chat, but let's give everybody like 2 or 3 minutes to maybe figure out how to unmute themselves and ask a question, or even just a comment. Or click the little reactions guy at the bottom and raise your hand if you want me to call on you.
I have a question. I apologize.
Oh,
I wasn't
Meredith.
able to join. Yes. Hi. I apologize. I wasn't able to join on time, so I don't know if this was covered, but you mentioned a medicine. Is it betadine?
Or for what, for colic or for like a laceration?
I believe it's like a sedative that some people just keep on hand to be able to give their horses if they are injured. And you did mention not giving it at the beginning of colic. And I'm actually not familiar with that. So I'm just wondering a little bit about what that is and when someone, like us who isn't a veterinarian might want to use it.
So, what I personally am familiar with and keep on hand, it's called Banamine, Banamine. So
Yes,
Banamine,
that's it. Sorry.
yes, it's prescribed by your veterinarian, so you can't just go out and get it, at any type of store. There's a paste, and then your veterinarian will more than likely always use IV Banamine if they're on site and need to give it to your horse. But for us, right, to have like in our kits, our first aid kits, it's going to be a long tube, almost kind of like a deworming tube of paste. And so what Banamine is usually used for, it's not a sedative, but it's more the effect that it has when you give it to your horse, depending upon their weight. Let's say in the case of colic, right? It relaxes them some. So if their stomach is painful or they're cramping up or they're just feeling discomfort and agitated, it can take the edge off. But again, we never administer that to our horses unless our veterinarian has given us the go-ahead. Does that answer your question?
It does, thank you. And I've heard it talked about before. And since you mentioned it, I wanted to ask a little more about that. And if you do have the go-ahead from your veterinarian to use it, is it something you might want to use like if a horse panicked? Would that be another possible use for it as well?
Did you say, sorry, you cut out a little bit, if a horse panics?
If he's injured and panicking and you're trying to settle him down.
I am not 100% certain on that question. It's not, again, it's not a sedative. If you have a panicked horse, we do discuss in our clinic twitching. So twitching is a type of maneuver that you can utilize that releases endorphins in a horse and can give you up to 10 minutes of a calm horse in order to, let's say, get them untangled from barbed wire fence if they're down or something. But it's not a sedative, Banamine.
I would just add like that on a good day, 2 of 3 of my horses hate having me do any kind of paste in their mouth. On a good day when they're not panicking. So
Yeah.
that's just
That's
from my own perspective.
Yeah, and that's, when twitching might come in hand. I don't know if anyone's familiar with twitching, but it's kind of like you grab a big piece of the skin on their neck, or you take there's different types of tools where you can twitch a horse and you grab the top lip and twist really tight. Again, only to be used in emergencies, to release those endorphins, which then calms the horse down for up to 10 minutes.
Thank you. I appreciate that.
Yeah, good question, Meredith. Thank you.
Yeah, like another 2 minutes for anybody that has questions, comments, or concerns, or otherwise. Our next one of these, while you guys are thinking about your questions, is May 8th is our general meeting, and we're bringing in Kent Weber from Mission Wolf. He has spoken to us before about all things wolf, and so he's gonna excuse me, talk to us about wolves in Colorado now that they're here, how to deal with dog and horse behavior and stuff if you're riding in those areas. So and avoiding any kind of equine first aid needs, which is unlikely with wolves. Like, I don't want to like give anybody any false ideas. Wolves are, you're more likely to see a bear or a mountain lion close to you than you are a wolf. So if you see a wolf near you, you've probably done something wrong and gotten yourself lost to the point that you're invading territory or something crazy.
Mayor,
Another minute or
yeah.
two, other questions.
I have a question about that poultice, that sugar iodine. When would you use something like that?
You can use a poultice is to draw out infection. So you can use the betadine sugar. I'm sure the recipe is online because it's you want it like super sticky with betadine, the sugar and betadine mix, but so it's there to pull out infection. So you could use that type of poultice on a puncture wound, right? That smells like it's infected or has pus coming out of it. You can use it on a hoof abscess, right? So if you cleaned the hoof out, you don't see anything, but your horse is extremely lame. Your vet can't come out until the next day, and you say all of a sudden happened. It's all the signs of a hoof abscess. You clean out the hoof, you soak it in an Epsom salt soak, and then you would put that poultice on the bottom, right, the sole of the horse's hoof, and then you'd put your tin foil, and then your diaper, and then your vet wrap, and then your duct tape hoof boot or whatever type of hoof boot you have. So again, it draws out, it dries out, right, and it pulls out any sort of infection. So in your manuals as well for the full day clinic, you also get a recipe for saline solution. So again, just a very dilute saltwater solution that you can use to clean out, disinfect any sort of wound. That's what we recommend using. I know a lot of people have used dilute betadine, dilute hexadine or beta hexadine, which is blue, right? We at Equifirst Aid USA recommend using saline solution. But if you are using the other ones, just make sure it's like the betadine and water, for example, is so dilute it looks like iced tea, or it's dilute enough where you would feel safe putting it in your eye. That's what I've heard from one of my veterinarians. So I hope that answers your question.
Yes, thank you very much. That was helpful.
Sure.
Very cool. Yeah, if anybody has any other questions, now's the time. I usually go with 30 to 40 seconds of complete silence before I accept that everyone is done.
Yeah, sounds good. any questions about hosting or anything like that? Again, there's not a lot to it. And all of my clinics in Colorado specifically, there's other, obviously other states too, but all of my clinics will be listed either on my Facebook or at the headquarters webpage, dash firstaidusa.com.
Brittany, if you want to share like your email address screen, like just in this last minute or two.
Yeah. Yeah, I can do that. See if I can get back there. Okay. There we go. There we go.
Wait, so for anybody still in here that didn't get that written down, like copy your email address down and get in touch. It's like, I need to do the same thing. I'm trying to find a venue for you down this way.
Yes.
So do that. We'll get on it.
We'll get on it. That'll be so much fun.
Yeah. Okay. Give it a few seconds just in case, like everybody's hanging out, which is very cool.
Yeah.
Brittany, I'll email you if you want to do another one of these in June. I feel like just a repeat of this would be really beneficial to other people that missed it or they couldn't get to this one for any
Yeah,
reason.
sounds good. Let me know. Just send me an email.
Cool. Okay.
Thank you so much. This has been very helpful. Really appreciate it.
I'm so glad. Thank you for coming. I appreciate it so much.
SJ, I would recommend sending her an email about the Elizabeth date and stuff like that.
Oh, yes. That one, I just scheduled it today. It's June 2nd
Very cool.
from 9 to 5 p.m. So it's going to be the all day, the prerequisite to the advanced course.
Okay. And then Shelly, if you want to send me a message on Facebook, we can look at hosting. That's it. Shelly's in Canyon City
Great.
and she's got a nice facility. So that would probably work. So shoot me a message, Shelly, and we'll figure something out and we'll get, I can get your email. We'll all get in the loop together. But we could,
and
everybody enjoyed it.
yes. And as far as, hosting, right? The horses that we need, right? Depending upon the size of the group, I usually say maximum of 12 people in a clinic. And so in that case, it's great to have like 3 people to a horse. So 1 can hold and 2 can work on the horse. And then you kind of switch who holds the horse while who bandages the horse and things like that. But again, the horses, they need to be loved being touched, and we touch their legs and we take all their vital signs, including temperature through the rectum, things like that. So, and if they can stand for like an hour and a half to 2 hours, even if they're munching on hay, that would be fantastic. So that's what we look for.
So like about 4 horses that can handle that or haul them in.
Yeah. Yep.
Okay.
Yeah. Yep.
Manageable.
Good. Yeah. Cause sometimes it's, 4 horses in the morning and 4 horses in the afternoon, depending upon, some get overstimulated and they're like, okay, no, like not even this bag of treats is going to keep me here any longer. So
yeah, like a youngster maybe is not the
best.
best.
No, not always.
All right. Very cool. Thank you very much, Brittany, for being our first presenter. It's wonderful. I hope everybody got something new and has decided to go and get a first aid kit or sign up for a first aid class, because it's stuff that we don't think of that like in the moment. It really would have been nice to have something like that. So it's these kind of things are really good to get you thinking about the stuff in advance. So I really appreciate it, Brittany. Hearing it again is really valuable for me. And I hope everybody here pulled something out of it. I am going to tell everybody real quick. I'm going to run through. You can head to RockyMountainBCH.com to see all of these. But real quick, we have May 8th is the Wolves in Colorado. May 14th, Verbal Cues for Horses. May 20th, NATRAC Region 3. May 23rd, Western Saddle Fit. And June 5th, Colorado Safe Horse is going to present about the horse in Arvada that was hit. And they've created like a whole organization for it. So they'll present about that. So for any of those that you want to see, again, head to RockyMountainBCH.com and you'll be able to see all of those links and everything. And it should be very easy to access and share. Please get the word out there that Brittany is amazing. And she has been voted 2 years in a row, hopefully this year, a 3rd year, that she is the, what was it? Best instructor?
Instructor of the year.
That's right. No big
Yeah.
deal. No big deal. Very cool. All right. I'm going to sign us off here, everybody. Thank you again so much for coming.
Yes, bye. Thank you, everybody.